Have you ever heard your shoes scrape across the floor and thought, why am I walking like this now? Maybe it happens in the morning when you first get out of bed. Maybe it happens when you walk across the kitchen. Maybe your family has said, you're dragging your feet, and you brushed it off because you didn't want to think about it. But listen carefully. Shuffling your feet is not just a small walking habit. It can be one of the earliest signs that your legs, ankles, balance, and brain are no longer working together as smoothly as they once did. And here is the part many seniors do not realize. Most falls do not begin with a big accident. They begin with something tiny. One toe catches the carpet. One foot does not lift high enough. One step is a little too short. One turn happens before the feet are ready, and suddenly the body loses balance. Today, I want to talk to you like I would talk to someone I care about. Not with fear, not with complicated medical words, but with the truth. If you are over 60, over 70, or caring for someone who is, and you have noticed the feet starting to shuffle, this video may help you understand what is happening, and more importantly, what simple step you can start taking today to walk with more confidence. Before we begin, please remember, this is general education only. It does not replace advice from your doctor. If your walking changes suddenly, if one side feels weak, if you feel dizzy, confused, numb, or unsafe, please speak with a healthcare professional as soon as possible. Now, let's start with a simple question. Why do seniors start shuffling their feet? Most people think it is because of age. They say, well, I'm just getting old. But aging alone is not the full answer. Many people in their 70s and even 80s can still walk with clear, steady steps. Maybe not fast steps, maybe not long steps, but safe steps. So when the feet begin to drag, when the toes stop clearing the floor, when the steps become short and hesitant, the body may be sending a message. And that message is this: something in your walking system needs attention. Walking may look simple, but it is actually one of the most coordinated things your body does every day. When you take a step, your eyes check the ground. Your brain sends the signal. Your hips keep your body centered. Your thigh lifts your leg. Your knee bends. Your ankle lifts the front of your foot. Your heel lands. Your toes push you forward. All of that happens in just one step. When you were younger, you did not have to think about it. You just walked. But after 60 or 70, one part of that chain may become weaker, slower, stiffer, or less confident. And when that happens, the body often changes the way it walks. Instead of lifting the foot clearly, it keeps the foot close to the floor. Instead of taking a smooth step, it slides. Instead of trusting one leg to hold the body, it takes smaller steps. That is how shuffling begins. And at first, it may not seem serious. You may only notice a soft scraping sound. You may start wearing out the front of your shoes. You may trip over rugs more often. You may feel nervous when turning around. You may start looking down at your feet more than before, but those small signs matter because the problem with shuffling is not just how it looks. The problem is what it does to your safety. When your toes do not lift high enough, your foot can catch on almost anything. A rug, a slipper, a doorway, a small crack in the sidewalk, a blanket near the bed, a loose cord, even the edge of a bathroom mat. And the truth is, many serious falls happen in ordinary places, not on a mountain, not during exercise, not while doing something dangerous. They happen at home, walking to the bathroom, turning in the kitchen, getting out of a chair, reaching for something, taking one tired step at night. That is why paying attention to shuffling is not about being worried. It is about being wise. Now let's talk about what may be causing it. The first common reason is weak leg muscles. To lift your foot and move forward, your legs need strength. Your thighs, hips, calves, and ankles all help with walking. But when these muscles lose strength, the body tries to save energy. Instead of lifting the foot, it slides the foot. Instead of stepping clearly, it takes shorter steps. This may feel easier, but it can make walking less safe. Think of it this way. If your leg does not lift, your foot has to travel forward very close to the floor. And the closer your foot stays to the floor, the easier it is for your toe to catch something. That is why strengthening the walking muscles matters so much. Not heavy exercise, not painful workouts, but gentle, regular movement that teaches the legs to lift again. The second reason is ankle weakness. This is one of the biggest reasons seniors shuffle, and many people never think about it. Your ankle is responsible for lifting the front of your foot. This movement helps your toes clear the ground. If your ankle is weak or stiff, your foot may not come up enough. That is when the shoe scrapes. That is when the toe catches. That is when you feel like the floor is suddenly more dangerous than it used to be. The ankle is also important for balance. When you wobble a little, your ankles help correct you. If they are slow or weak, your body has less time to recover. So if you want to walk better, you cannot only think about the knees. You must think about the ankles too. The third reason is knee stiffness or knee pain. When the knees hurt, your body protects them. That is natural. You may stop bending your knees as much. You may take shorter steps. You may avoid putting weight on one side. You may walk more slowly and stiffly. At first, this feels like protection, but over time, it can create a shuffling pattern. The knee does not bend. The foot does not lift. The step becomes short. The body becomes cautious. And cautious walking can sometimes become unsafe walking. The fourth reason is fear of falling. This is very important, especially for people over 70. Maybe you fell once before. Maybe you almost fell. Maybe you saw a friend fall and not recover well. After that, your body remembers. Even if you do not talk about it, your nervous system becomes more careful. You may start taking tiny steps. You may walk with your feet wider apart. You may stop swinging your arms. You may hold on to furniture. You may avoid walking outside. This fear is understandable. It is your body trying to protect you. But here is the problem. When fear makes your body stiff, your balance can get worse. Good walking is not fast walking, but it does need rhythm. A safe walker lifts, shifts, and steps. A fearful walker often freezes, shuffles, and hesitates. So the answer is not to rush. The answer is to rebuild trust in your steps. The fifth reason is poor foot awareness. Some seniors do not feel the floor as clearly as they used to. The feet may feel numb, cold, heavy, or less responsive. When the brain does not get clear information from the feet, it becomes less confident about where the ground is. So the body keeps the feet low. It takes small steps. It avoids lifting too high. Again, this is the body trying to stay safe. But if the feet stay too low, the risk of tripping increases. This is why shuffling can be worse at night. In dim light, your eyes cannot help as much. If your feet also do not feel the floor clearly, your balance has to work even harder. That is why good lighting, supportive shoes, and clear walkways are not small details. They can make a real difference. Now, I want you to think about your own walking for a moment. Do your shoes scrape the floor? Are your steps shorter than before? Do you trip over small things? Do you feel nervous when turning? Do you look down at your feet more often? Does one foot feel slower than the other? Do you feel unsteady when first getting out of bed? If you said yes to any of these, do not panic, but do pay attention. Your body may be telling you that your walking pattern needs help. And now I want to give you a simple exercise that can help. I call it the lift, shift, step exercise. It is simple. It is gentle. You do not need to get on the floor. You do not need special equipment. You do not need to move fast. You only need something stable to hold, like a kitchen counter, a heavy table, or a sturdy chair that does not move. Please do not use a chair with wheels. Do not do this in slippery socks. And if you feel dizzy, weak, or unsafe, stop. Now stand beside your support. Place one hand on the counter or chair. Keep your feet about hip-width apart. Stand tall, but do not make your body stiff. Relax your shoulders. Look forward. Now we begin with the first word, lift. Slowly lift the toes of your right foot while keeping your heel on the floor. Just lift the front of the foot. Hold it for 1 second, then lower it. Now lift the toes of your left foot. Hold for 1 second, then lower. Right toes up, down. Left toes up, down. This may look small, but it is powerful. You are waking up the muscles that help your foot clear the floor. You are teaching your ankle to lift again. You are reminding your body that walking begins before the foot moves forward. Now the second word, shift. Gently shift your weight toward your right foot, then shift your weight toward your left foot. Right, left, right, left. Do not sway too far. Do not lean your whole body. Just feel your weight moving from one leg to the other. This matters because before one foot can step, the other foot must support you. Many seniors shuffle because the body does not fully trust one leg, so both feet stay close to the floor. But when you practice shifting weight gently, you teach your body, this leg can hold me. Now the other foot can move. Now the third word, step. Hold your support. Lift the toes of your right foot. Shift your weight gently to the left leg. Now take one small step forward with the right foot. Make sure the toes clear the floor. Let the heel land gently, then bring the foot back. Now do the same with the left foot. Lift the toes. Shift your weight to the right leg. Take one small step forward. Heel lands gently. Bring it back. That is the whole exercise. Lift, shift, step. Again. Lift the foot, shift the weight, step with control. This is not about speed. This is not about taking big steps. This is not about proving anything. This is about teaching your body the safe order of walking. Foot lifts, body shifts, step lands. When you practice this slowly, you are training the exact pattern that shuffling often loses. Now, let's talk about how long to do it. Start with 1 minute a day. That is enough. 1 minute beside the kitchen counter. If it feels safe and easy, you can slowly increase to 2 minutes, but do not force it. With seniors, consistency is more important than intensity. A safe exercise done daily is better than a hard exercise done once and then avoided. Now, when should you do this? The best time is before your first serious walk of the day. For many seniors, the riskiest time is in the morning. The body is stiff, the feet are sleepy, the blood pressure may shift when standing. The balance system is not fully awake yet, so before you walk across the room, take a moment. Sit up first. Move your feet. Stand slowly. Hold something stable. Then practice lift, shift, step. Just a few rounds can help your body wake up before you start moving. You can also do it before walking outside, or before going down a hallway, or anytime you notice your feet beginning to drag. Now I want to give you a simple phrase to remember. Lift before you step. Say it quietly in your mind. Lift before you step. Not fast, not big, just clear. Lift before you step. If your shoes start scraping, slow down and reset. If you feel rushed, pause and reset. If you are turning, move your feet and reset. This small reminder can change the way you walk. Now, let's talk about turning. Many falls happen when people turn. Why? Because the head turns first, then the shoulders turn, then the body turns, but the feet do not move quickly enough. The upper body goes one way, the feet stay behind, and balance is lost. So when you turn, do not twist your body while your feet stay planted. Take small steps. Turn your whole body. Move your feet with your shoulders. It may feel slower, but it is much safer. This is especially important in the kitchen, bathroom, bedroom, and hallway. These are places where people turn often without thinking. Now, there are also a few home habits that can help. Keep the floor clear. Remove loose rugs or secure them. Do not walk in loose slippers that slide around. Use night lights between your bed and bathroom. Keep your phone, water, and important items within easy reach. Stand for a moment before walking, and never rush because the phone is ringing or someone is at the door. No phone call is worth a fall. No doorbell is worth a broken hip. Your safety comes first. Now I want to say something encouraging. If you have started shuffling, it does not mean you are helpless. It does not mean you are too old. It does not mean your walking cannot improve. It simply means your body needs attention. Walking is a skill, and skills can often be trained. You can train your feet to lift better. You can train your legs to support you better. You can train your balance to respond better. You can train your confidence to come back slowly, not overnight, not with magic, but with small, safe, steady practice. And that is what older adults need most, not extreme exercise, but dependable movement. Movement that feels safe. Movement that makes sense, movement that helps with real life, because the goal is not to become an athlete. The goal is to walk to the kitchen safely, to go to the bathroom at night safely, to visit your family safely, to step outside with more confidence, to keep your independence for as long as possible. That is why this matters. A small shuffle today can become a bigger problem tomorrow if ignored, but a small correction today can also become better walking tomorrow if practiced. So here is your simple plan. Today, find a safe place near a counter or sturdy chair. Stand tall, hold the support, lift your toes, shift your weight, step gently. Do it for 1 minute. Then notice how your feet feel. Do they feel more awake? Do you feel more aware of your steps? Do you notice one side is weaker? That information is useful. Do not judge your body. Listen to it. And if something feels wrong, painful, sudden, or unsafe, talk with a doctor or physical therapist. But if it feels gentle and safe, practice it daily. Lift, shift, step. That is your simple fix. Before we finish, remember this. Shuffling is not just a sign of getting older. It is a signal. It may be telling you that your feet are not lifting well, your ankles are not helping enough, your legs are weaker than before, your balance is less confident, or your body is afraid of falling. And when you understand the signal, you can respond wisely. You do not have to rush. You do not have to be perfect. You do not have to do difficult workouts. You just have to start with one safe step. Lift before you step. Clear the floor. Move with control. And give your body a chance to remember how steady walking feels. If this helped you, practice the lift, shift, step exercise today. And stay with Senior Health Podcast for more simple, gentle ways to protect your balance, strengthen your legs, and keep walking safely after 70.